Question number one. What are the needs and challenges of the heroic phase? In the heroic phase, that's the stage where people are stepping in to help survivors of a traumatic experience be able to get food, be able to get shelter, water. Um, People who have suffered from a traumatic experience, they're left feeling the grief and loss of their house or belongings. They might have lost someone due to the trauma that they have experienced. If it's a natural disaster, a lot of people have drowned or they have perished. Just depends on the situation. I feel like in the heroic phase, everybody comes in with such an energy after seeing images on the news or on social media, or if they live, nearing neighborhoods. Um, they come out with a lot of energy to help other people who are in need. Sometimes I think in this stage, there's a lot of denial. Um, they don't know um, just the magnet. they don't grasp the magnitude of the situation. Um, Sometimes traumatic experiences, such as natural disasters, are a long term impact. And a lot of them, end up getting overwhelmed with the situation. They done all they can and they have to keep going. It's like an everyday thing. So of course resources start to run slow, or there's not enough to help everybody. So it can be challenging in this phase. Some of the things that were pointed out in the video, um, and the needs and challenges, were that there's a lot of denial of the impact of the disaster that the disaster had on their home. There's a lot of denial of the impact the disaster is having on themselves and their families, and you know they they stockpile community assets to be able to help out in situations such as this. Um, there's a lot of greater sensitivity. As you know, a lot of people who are Christian went out there to try to help out others. Um, the second question, the honeymoon phase can include a crash point. Describe who, when, and why this may occur. Now, the honeymoon phase is where a lot of people start to feel hopeful after the traumatic experience they have endured. They start to feel hopeful. They have such gratitude of all the volunteers and all the help that they have been receiving. Um, the crash point would be right after the heroic stage. As I said, the heroic stage is where everybody's coming in and everybody has all this energy. They're gonna tackle all these things and be able to get back to normal, which unfortunately that is not always the case. Um, so everybody's left to the point of exhaustion and burnout. Everybody's so focused on getting things done that they forget to do self-care, and they forget to do self-care, so they don't take days off. They don't think about themselves. They could either hardly be eating or sleeping, and that can affect anybody who is helping out survivors. um Everybody needs to, you know everybody wants to have a sense of relief, but unfortunately these people who are coming out to help are not taking care of themselves as they should. So they're the ones who end up getting affected by this whole situation. Question number 3. During the disillusionment phase, fear, anger, and hopelessness can set in. What type of clinical conditions may develop from these circumstances, and what type of treatment is best to overcome them? This is the phase where, after everything is said and done, people start to realize that about the magnitude of the disaster. Um, so they start to pull out financially. They stop trying to offer any type of support or have any resources available. Um, because of this, it can cause a lot of people to feel hopeless, to feel abandoned, to feel fearful of what's going to happen, to feel angry because nobody is helping them anymore. Um, a lot of things that can come up, clinical conditions that could come up from this will be PTSD, which is post traumatic stress disorder, anxiety, and depression. Um, this can lead, these type of clinical conditions can also contribute to people getting addicted to alcohol or to any type of drug abuse. Um, People tend to be more violent towards others or to their loved ones. Um, there's also the high risk of people trying to commit suicide because they don't know how to cope with everything that's been going on around them. Um, they just have a sense of isolation and they don't know exactly how to cope with it. Sometimes this is where the violence and the addiction comes from. These are like their coping mechanisms that's the only way they know how to cope. But obviously, these coping skills can be deconstructive towards them. Um, in contrast, disaster mental health counseling may involve counseling overwhelmed, resistant clients who vary significantly in their relationship to the disaster, involve frequent sudden changes in terms of counseling routine, location, and clients, occur in various settings that can be noisy, chaotic, public, unpleasant, and dangerous, and be short and infrequent in terms of sessions. So the type of treatments, obviously, it is the counseling setting can vary because of the situation that it's going on. Um, but our best course of treatment would be to find a type of assessment that could identify all those factors that the client is demonstrating um, demonstrating after the traumatic experience. And once we are able to assess this diagnosis, we can be able to find a course of treatment path that would be able to help this client learn better coping skills and healthier habits to help them overcome those challenges that they're facing. Anybody who suffers a traumatic experience struggles, and it's not something that could be only a couple of days. It can last weeks, months, or even years in the aftermath. Um, but being able to provide support and services um, could be beneficial for somebody, for these survivors. Um, Also, being able to focus on burnout prevention. These people don't stop; they just want to, go back to normal. But what is really normal, even after this situation? Even providing training for people to be more aware of their mental health and encouraging and referring people to other different types of services would be beneficial for all these survivors in this phase. Some of the resources that I use for my video come from our textbook from Gary Miller, and that is Fundamentals of Crisis Counseling. I also used an article from the Australian Institute of Professional Counselors, and the article name was Common Stages of Disaster Recovery in Counseling. And I got that article from counselingconnection.com. Thank you.